Great. All right. Welcome, everyone. I'm Vanessa Freytag. I'm the president and CEO of 4C for Children, and we're so delighted that you're joining us today for the third briefing that we've put together since the pandemic started. When we did our first briefing, we recognized at that time there were many questions about childcare and what was going to happen to it. We were happy to share what we know, especially in our unique role as the child care resource and referral agency in two communities in Ohio. That's the Miami Valley community and the greater Cincinnati community. And we did another session about a month ago, and we thought this might be the right timing to do a third session because there's a lot happening right now, and there's some key things that we want to share with you, some of which certainly have come from your questions about childcare. We will have the opportunity at the end of this session to answer your questions also. So you should have, if you're on a computer, a Q&A box. So not the chat box, if some of you are familiar with Zoom, but the question and answer box. You could just type your questions right in there. And we should have about 20 minutes towards the end of this session, and happy to answer your questions. So again, welcome to the 4C for Children Child Care Briefing. Today's focus will be on several big components of what's happening in childcare today. I'm the CEO and president of 4C for Children and have been in this role for about 5 years. Certainly no one expected there'd be a pandemic in the middle of it, but we're here to serve our communities. And so that's part of what we're going to talk about today. For those of you who aren't as familiar with 4C for Children, just to quickly frame in who we are, because we're a bit of a unique agency. We have 3 core areas of work that we do. All of this is done in Ohio. The first is that we train and what we call coach, which is helping to implement in the classroom the teachers, the child care providers that are community child care providers. So this is about 1,700 child care providers in the 15 counties that we have responsibility for in this area of Ohio. And we train and coach on educational quality for young children, certainly health and safety, been a big part of what we've been doing lately. And the state of Ohio designates one agency per region to do this work, to fulfill this work. And we've had that role for many years, well over a decade. We also just, for those of you who are familiar with Preschool Promise, certainly there's one up in Miami Valley, there's one in the city of Cincinnati. We also are the core entity that works on quality improvement in the classroom for both of those very important activities. We do 80 to 90% of that work for those two community-based efforts. Second area of our work is what we call resource and referral. And this is where we help parents figure out, how to match their work schedule, their transportation, the ages of their children, and childcare. This can get very complicated for families who perhaps have transportation issues or perhaps don't work, an 8 to 5 shift. We particularly serve families that utilize state funding to help pay for childcare. A year of childcare is about the same as a year of college, actually, state college. So those parents often turn to us. Right now, I would tell you there's 30,000 families roughly that get assistance from the state just in those 15 counties. So we have a lot of families that we assist. And lately, and we'll talk a little bit more about this, this work has gotten very big, not because there's so many more families, but because we contact programs to identify if they even have open slots. And that has gone from, maybe 5, 6, 7, 8 calls pre-pandemic to 20 to 30, and it's actually not uncommon that we have to make 40 or 50 calls to help a parent find a spot for their young child. Then the third big area of work that we do is the child nutrition program. This is the parallel to the school lunch program in K-12. And we assist with over 2 million meals, nutritious meals, that are then shared in childcare settings for children, because we all know that as those young brains go, they need healthy food to grow with it. So this is the work we do overall, and I would tell you, this work, although our core funding comes from the state of Ohio, it is also dependent upon many of you. You have been so generous to assist us in this work over the many years, because for about every dollar that comes from the state, there's another dollar that we have to raise and match to that in order to serve over 1,700 programs and 30,000 families. So let's hop into what we're going to talk about today. Our first item is about quality. And quality, for those of you who've also been part of our work for a long time, you know that there was a deadline, July 1st of this year, that required all community programs to reach at least an initial level of educational quality. We had a lot of work to do in our regions, and it has been quite the journey, but a very successful journey based on your support and great work among our team. Many of you may remember the Ramping Up for Quality campaign. That deadline has shifted to September 1st, but in essence, it's right upon us. And if a program isn't able to reach that quality level, they will no longer be able to serve any of those 30,000 families that we talked about that get assistance. So let's take a quick look. I'm going to just show you the greater Cincinnati region. And across the last 18 months, this is what has happened. So I wanted to make sure we started with a little bit of good news as we went into this briefing. It is extraordinary to see the growth. And this growth, what we focus on, although we're working with the programs, we translate this into how many children, what percentage of children will be in a quality setting. And you can see 18 months ago, a little more than 18 months ago now, that was less than half of the children. Now we're up to 95%. That 97% goal is actually our own agency goal. We wanted to really try and get every child in a quality seat. We've got a little bit more time to go. We'll surely hit that. And I can tell you, for those of you who may be joining us from Miami Valley, in Miami Valley, actually, we're already up to 98% of children. So good news to start with. And what you can't see in this is that in working on quality, those childcare programs also had to learn a lot about process, and policy and procedure, because that's all part of embedding quality, safety, health. And it actually, as hard as this pandemic is, it made them better prepared to actually work on the things that they needed to, as the state put in place a lot of changes in their in the guidelines for sanitation, for child separation among groups, things like that. So last thing I'll leave you with before we go to our next point is, I would point out to you, childcare is part of our economic infrastructure. When you look at this chart, and if you were to imagine if you're up in Miami Valley, a very similar chart, these are working families. A lot of these are essential workers, as we describe them in this pandemic. The success or the future of childcare is going to be intimately connected to the economic health of our communities as we go through this pandemic. So I wanted to, do we have the Miami Valley slide in there? I can't remember. No, okay. So I want to go next to the front lines. And I wanted to make sure that we also gave you not just numbers, but a closer picture of what's happening in childcare. And I'm going to have two of our leadership team members join us. Delorise Pennington, she leads a team that focuses on licensed family childcare. So in our regions, about 55% of all childcare programs are this kind of a program. And again, they tend to heavily serve our essential workers, and it's a critical component. Our community looks a little bit different than most of the rest of Ohio. We have a lot of family child care providers. So Delorise leads the team that works with them in the Southwest Ohio region. And then we also have Leslie Johnson joining us. She is another one of our leaders. She leads a team that works with center-based child care. So that's, as you can imagine, everything from a center that might have 20 or 25 children to centers that may have several hundred children. Again, all are community-based, so not the ones that are in a school, but these are community-based. So I'm going to let them take it away from here and share with you some insights on what they're seeing.
Good afternoon. As Vanessa stated, more than half of our region's providers are in the family child care. And with those numbers, more than half of our region's family child care providers, they stepped up to the call and became pandemic site. And this was even in the midst of them having their own personal stories and lives. They were very committed to caring for the first responders' children. And these calls were not just regular hours. Family child care they're unique in the fact that they do often operate multiple shifts, which could be 24 hours of care. So just to kind of give you some insight to a really positive experience that happened during the pandemic, we had a family child care site that had worked really hard to achieve a higher quality rating. She was a 1-star rating, which is the lowest rating on our rating scales. And she wanted to increase her quality to a 5-star rating scale. So she worked with our agency and our coaches, made some changes to her environment and changed and adapted her program to meet this rating. Well, she applied for the rating right at the end of February. With March being the pandemic, she was unable to get a visit from the state. She answered the call and continued to provide and decided to become a pandemic site. And as she was a pandemic site, she maintained the level of high quality that she had worked hard to change to in her program, meaning that she still provided these same things that she was at the time that she applied for her rating. Upon when June entered, state workers began their visits again. This provider was one of the first group of providers to get her licensing inspection, and she was able to maintain her 5-star rating even in the midst of a pandemic, would be the way that I would like to describe this. Every program wasn't necessarily able to maintain or have this success. On the flip side, I had a program who was same story in terms of wanted to increase her quality, worked really hard to get this quality increased, and she was dependent on the state to provide some educational materials to move forward in this process. Because of the pandemic, the state had made a decision to focus on the pandemic, and they cut the support that went to programs around the educational materials. As a result, she also received her visit in June, and she was not able to get an increased rating because she didn't have the materials that she needed from the state. She was dependent on state funding, and she wasn't able to get that. And as a result, this program's rating was decreased, and she has to begin the process all over again. Leslie, you can go ahead and share your story.
Thank you. Thanks for this opportunity to share from the center-based perspective. I was tasked with giving 3 ways programs have adapted throughout this crisis, as well as some obstacles and challenges that they faced. First, programs have shown great resilience throughout this time. Many became pandemic centers to support our essential workers in order to keep our economy, as Vanessa stated, from coming to a grinding standstill, and to keep our medical facilities open and appropriately staffed. They often operated on shoestring budgets with lower revenue due to reduced ratios, and even with the 5-star compensation, they were unable to continue that high that shoestring budget. They had increased costs of cleaning and personal protection equipment, and it was a struggle for them. Secondly, they have applied for the monies that were set aside for their use by the CARES Act and have been fiscally responsible in their efforts to increase health and safety for their staff and for the children in their care. Thirdly, and most importantly, they have not abandoned their pursuit of quality during this time. For example, one of our centers, who had also applied for their 5-star rating in early March, prior to the closing of childcare, became a pandemic site for a time while maintaining their 5-star quality best practices throughout the pandemic. And upon the reopening of childcare, was awarded their 5-star rating in June, allowing for up to 35 publicly funded childcare seats and a high quality program. Unfortunately for centers, not all centers fared so well. They have been forced to close their doors with little to almost no hope of reopening. This is due to staff unable or unwilling to return to this high risk, underpaid work environment, or just being sorely underfunded because they were found ineligible for the PPP, as was the case of one of the programs I coached. A small 1-star rated program serving primarily children with special needs was told they were ineligible for the payroll protection program because their losses were not deemed great enough. For this small business owner and for the families who already struggle to find quality nurturing care for their children, the loss of this particular program is truly immeasurable.
Thank you, Leslie and Delorise. And what the stories that they've shared really are the stories that are playing out countless times over the last few months. And we're going to talk in a minute about where things are headed now, which is important. And as you can hear, there are some bits of good news, but this arena is struggling mightily to make it through the pandemic, and many others are dependent upon childcare. So there is a ripple effect that happens. So for the moment, we're going to shift gears for a second. And I know one of the questions that has come up quite a bit is about back to school plans. And we're getting a note that they're having trouble hearing me. Okay. All right. We're going to talk a little bit about back to school plans. And we know that, well, in our region, there are, I believe, over 80 school districts in our region, are the 2 regions in Ohio that we have responsibility for. So there's lots and lots, as you well know, of different ways that the schools are approaching this. And in many cases, the schools are looking for blended learning options. And those blended learning options, in some cases, you may have either parents or the schools themselves may have indicated that childcare may be needed on those days when the child is still the kindergarten through 6th grader, that's the school agers, that child may need somewhere to be if their parent in particular is a working parent. So I want to take a second and just touch base on that. You know, the reality is this solution is one that is really unclear right now for a couple of reasons. Although there are a small number of programs, center-based programs typically, that have perhaps a couple of unused classrooms for various reasons, and they could convert those classrooms into additional care for school agers. There's a couple of issues. The first is that school districts that I've talked with know that they need thousands of seats. And what we're talking about is maybe a few hundred seats that might be available with unused capacity. Second component of this is that school-ager care during the school year is really only that, and I had this with my own children, before and after school care, so an hour or two before school, an hour or two after school. At the moment, two problems. One is that in the middle, if you were to put a child in that space for the whole day, that program actually may not have capacity for that child, because during the day, that they can only have so many children. That space may well be filled by a younger child that comes in a little after that school ager would have left for school, and then goes back home a little before that school ager is coming back from their school-based setting. So capacity is going to be a big problem. And then the second question is about, well, how do we pay for that? Particularly for parents that get assistance from the state, which, as you heard, is thousands, tens of thousands of parents. Because first of all, the pool of funding that supports parents that need assistance for childcare really is at capacity already. There aren't additional dollars that can be devoted to this, as well as the fact that on the federal level, the interpretation of the block grant money, which is sort of the overarching pool from the federal side that this comes from, says you cannot pay for that child twice. And in the eyes of that money, that child is already paid for in the school-based setting, because the public school or private school, whoever that is getting the funding for the whole day for that child, because they're still teaching that child, even though it's remotely. And then you'd have to pay for that child setting twice if they're in a childcare setting. So these are some of the questions that are not yet answered, and we'll have to understand more. We'll have to see whether or not the federal government will commit dollars to this, and we'll have to see whether or not, even if they commit dollars, where might these children go? There is some ability to utilize some great partnerships, and I know many school districts are looking at that, or, for example, rec centers. But again, our concern is that there are thousands, tens of thousands probably, of seats that are actually needed, and it's not clear yet where that will come from. So I wish I had better news on that, but I also have gotten lots of questions, so I hope that helps you understand why this isn't a simple answer. There's a lot of components that have yet to be figured out. So that kind of leads me to the next point, which is about federal and state advocacy. So I want to talk about the state for just 1 second first. The state of Ohio, honestly, has done a tremendous job in supporting childcare, community childcare that we're talking about throughout this pandemic. One of the most important things they did was they committed $60 million of the State CARES Act money to support childcare programs. Now, unfortunately, that money is literally going to run out at the end of this month, and it is not replaceable unless the federal government adds more dollars to that pool. But there's no question in my mind that it has helped childcare programs keep their doors open. I was on a call about 2 weeks ago with agencies like ours across the country, and several states had not had this support from the governor's office, their governor's offices, and that child care arena was already experiencing a partial collapse. Because the truth of it is, childcare is and always has been very poorly funded in most states and across the country. So it is fragile. It is fragile. Even pre-pandemic, it was fragile. So let's talk about the federal side of this, because this is really an urgent moment that I would share with you. So the good news is, I think everyone has kind of figured it out that childcare in and of itself is important. The education that childcare provides is really important to helping children be kindergarten ready when they get to school. And childcare is part of the infrastructure of our economy. I think that last point is the one that has become utterly clear over the last few months. So the good news is there are actually several bills that are percolating right now in Washington, D.C. And really, this is where the relief has to come from, to the tune of what's really going to be needed to help childcare between now and the end of the year, because it is likely that these stressors, most or all of them, will be in place through the end of the year, is $50 billion, and that's billion with a B. That relief has to come from the federal government. So we're at a critical moment in time, literally right now, as we sit here. There are debates going on. They're trying to finish up a bill or bills in Congress that will provide relief for many different parts of our economy. Childcare is a component of several bills, although at all sorts of different levels. And it is vital, not only that childcare be part of those relief bills, but that it is enough of a component of that relief bill. So when we get to, at the end here, some of the things that you can do to help our community's childcare, that's going to be one of the really important things to help with. From here, I want to just shift for a moment about this, and Leslie and Delorise mentioned some of this, that childcare is at this pivotal moment. It's experiencing a lot of stress that's coming from a lot of different arenas. Why don't we flip to the next slide, Alona? This is not everything, but these are the big things. So these new rules and guidelines are important. They're about safety, they're about health. Childcare has always been predicated on safety and health guidelines. It's why our childcare leaders, our teachers, actually not only are education experts, but before they ever open their doors, even in non-pandemic times, they've spent a lot of time learning about and training on germ control techniques, sanitation techniques, all of that. But there's a whole new layer of these. So that takes time, it takes energy, it takes training. And that's just that component of it. As well as, I think you can understand that our children are going through all sorts of stressors right now, physically, mentally. So that is also a part of the training and support that agencies like ours are doing to augment that and support those teachers also. They're going through their own set of stresses. Costs, again, Leslie and Delorise mentioned this, exponentially, those costs have gone up. And we've had many generous donations. I know P&G, for example, has been a wonderful partner that has helped us and others distribute thousands of pieces of PPE. But again, when you're in childcare, it's like healthcare. Every single day, there's a huge amount you need. And so that's critical. Now, one thing I would point out to you, the governor of Ohio has now mandated, I think as of 6 o'clock tonight, masks. And childcare, the guidelines were that they wanted you to wear masks as teachers. There were some exceptions for things like if you had an underlying health condition. Masks for children is kind of a whole different area. I won't get into a lot of that, but what I can tell you is masks are not appropriate for our youngest children, children that are 1, 2 years old. And that has been one of our concerns, is making sure that providers and parents understand that. But this cost is high for childcare, higher than most arenas. Then the financial losses, kind of the last 2 points there, financial losses, the teacher-child ratios. To give you a feel for this, the centers that we are talking to, at best, are functioning at 60%. So imagine, and that's your revenue. So imagine 40% of your revenue just is gone and not going to come back anytime soon. And even family childcare, most of which are licensed to take up to 6 children in their care, even though that number falls under the ratio limits, the reality is it is not uncommon at all. Most family childcare is experiencing 1 or 2 or even more families where their child is not back in care. In some cases, it's because the parent may have lost their job or be furloughed, so they can't afford it. Or it can be because that parent is still having some concerns about the child returning. So again, even in a family child care setting, if 2 of your children are not coming into your care, a third of the revenue that just keeps your doors open is gone. So I can't stress enough that the financial fragility of child care is in the brink right now. And that also is part of why, you know, we are also seeing that teachers, and I think Leslie talked about that a little bit, that childcare has mandated ratios for teachers, and that's important. They need the same number of teachers right now, but fewer children per teacher. So if you have a teacher or 2 or 3 that isn't coming back, it's devastating for programs. So I do want to leave you, though, with what do we do? And I chose this quote, "Understand the past and you can shape the future," because I want to take us back for a moment to a time that maybe some of you know, but some of you may not know. And I want to take you back almost 50 years. And believe it or not, almost 50 years ago, we were this close. We were one signature from having universal child care in the United States. It was an amazing moment. It was a bipartisan bill. The House had passed it. The Senate had passed it. It was amazing. And this was in recognition, certainly of the educational component, but the biggest driver was that women were, you know, entering the workforce in large numbers, and they understood childcare was a driver to economic success of the country. It was called the Comprehensive Community Child Care Act. That's how it was known, Comprehensive Community Child Care Act. That bill was vetoed. It was vetoed on the president's desk in, I believe, 1972. So this actually was also the birth of 4C. And many people often ask me, so is one of the 4 C's in 4C Cincinnati? And the answer is no, not at all. None of them are. The C's are Comprehensive Community Child Care. That's where the name comes from. So, you know, why do I share this story with you? I share it with you because what I have been thinking about is what would be different today, 50 years later, if that bill had passed. I see a number of things that would be different. Our child care programs would have more financial stability than they do today, no question about it. Our working parents would have more help. They would not be teetering on the brink when it comes to paying for childcare, because although 30,000 parents are getting help with childcare, there's a big chunk of parents that really are not at economic self-sufficiency, and yet they have to pay for childcare. And next to their rent or mortgage and their food, childcare is the next highest bill for them, and they get no help with that. I also can't help but think about teachers, because if the childcare programs were financially stable, we wouldn't have teachers who earn on average $10 an hour in our state, and they're leaving to go take a job that will pay them $12 or $15 an hour plus benefits. This is where we are right now. I see, as we look forward, that what we do right now will have a great deal to do with how childcare looks in the next 10, 20, perhaps even more years. Because if we don't ensure that childcare survives this in large part, this pandemic, we will be moving ourselves backward literally decades. One of the things that has improved, it's not enough yet, but access, the number of childcare programs has increased generally overall. We can take a big step backwards. And hearing about the states where they were not getting support and that a partial collapse had already happened, it was really sobering, I can tell you that. So what we do right now will shape the future. It will shape the future of childcare. It will shape the future of working families for sure. it will shape the future actually of the business community, because those working parents work for those businesses. And ultimately, it will shape the future of our communities. So let's talk about the last item before we get to Q&A, how you can help. Two big things. We're going to send you an email after we're done today that will make it easy for you to do this. The first one is being an advocate for relief at a federal level. And I would tell you, I would ask you, if you want to advocate today, literally today is the day you need to send that message. And we'll be sending you to a link. Groundwork Ohio is an amazing advocacy partner. They make it very easy for you to do this. I would put in your own words your concerns, especially after hearing our discussion today, but it has to happen today, because right now they are negotiating this bill, and this will likely be decided in the next few days, because then Congress goes out on recess. The second component is that we, as 4C for Children and in our role, we recognize that even with that federal help, it's not going to happen fast enough. The state funding will run out in August. I should say August 1st or July, the end of July. We need to help preserve every possible seat, particularly those seats for parents who are getting assistance to pay for those seats. We need to preserve every seat in our community. And that campaign is a campaign that is vital to ensuring that some of those dollars will help carry our child care programs through the next month or so. It will help them get the training that they need. We've been training literally several thousand child care providers. We were able to do that in the last few months with some dollars from the state, but those dollars are gone. And also support child care programs in the other ways that they're going to need it. So that link will be there too. I know many of you have been tremendous supporters of our work over the years. I would tell you, this is not about us. This is about childcare right now. And this is about together making sure that we do everything we can in Greater Cincinnati and Miami Valley to ensure that our childcare programs successfully navigate this pandemic. We need them, our children needs them, and the families and businesses need our childcare to be successful and strong through this. So I'm going to pause there. Alona, I think we've got a couple of questions, and I think we're going to bring back Delorise and Leslie. Okay. And as we bring them back, I'm just taking a look at the questions, and thank you so much for the questions that have come up here. So one question that's come up is a question about some of our community resources, like museums, like zoos. And, you know, what about those? Can they assist with this capacity question? And the answer is it's unclear right now, because the licensing that would be needed for you to do that is not necessarily in place right now. Leslie or Delorise, if either of you, which maybe Leslie, this would be better in your arena, because I think what we'd be talking about is a little bit more like a center base. Mm-hmm. Can you just give folks an idea of what are a couple of things, you know, we can't just open the door and say, hey, we can take children. What are a couple of key things that license does?
So we need to make sure that the space is approved for childcare. That space there has to be enough space per child. There has to be safety things put in place to ensure safety of children while they're in that space. And that just can't happen overnight. And often those public areas are not equipped to do that. That's why we go through the licensing process for centers.
That's great. And, you know, the other thing I would add to Leslie's comments too is it would require an act, in essence, at the state level to do that.
Absolutely.
And one of the things that's happening right now is you don't just say, here's the rules, and if you follow these rules, you can assist. The state actually has to come in and visit, right, Leslie?
They do.
Right. And so our folks at the state are doing an incredible job. The Job and Family Services team, and as well as at the county level, because they tend to work with the family child care, they are at capacity for sure with this. So there's a lot of questions about that. I know that this has come up, I can tell you that, at the state level. And at the moment, there doesn't seem to be a clear path. Another question that's popped up is, about large companies. Should we be asking large companies to assist their employees with childcare costs? Short answer to that would be absolutely. But I would say a little bigger answer to that would be, I really think this is a moment, and I say this as the leader of an agency. We have many, many wonderful team members. This has been the time from my seat, and I would suggest to other business leaders, to really dig in and understand, really almost on an individual level, the challenges that each employee might be facing. As we did that, what I can tell you is we found ways in which we could assist. And it may be different from employee to employee. I would definitely encourage businesses to think about right now, finding out if one of the barriers for their staff members, some or all of their staff members, is paying for childcare, and really look at this as an investment in that employee and as well as in their business. So definitely would encourage you to think about that. Leslie, Delorise, I don't know if there's anything you would add to that. Okay.
Absolutely. When thinking about the children, that families, and that being an impediment for people to be able to return to work, or people to be able to return to work fully and not be concerned about the care of their children. It's just like when we think about other amenities that employers offer, this is definitely a huge part. And without this, we are going to have a decrease in people being able to work or return to work. Definitely, there may be a potential for health and safety concerns about people leaving their children at home because they can't figure out the child care component. So this is definitely, when we think about this, I want you to think about it on the big term for employees, but also in Hamilton County is already an at-risk. Hamilton County is at risk for children being left unsafely. We want to remove that barrier. We want to make sure that we aren't doing anything to increase those numbers, but hopefully we can decrease them.
Unless, Delorise, just to clarify, when you say already at risk, I just want to be sure folks understand this has to do with the statistics, correct, about children in our community?
Yes, it's statistics. This is the statistics of children in our community. And we have some initiatives in place because we showed up at the top of the chart for the state of Ohio. So this is not just something that 4C is saying, this is something that is documented and has been researched. And something that we spend some of our coaching hours supporting the adults that care for children to make sure that they have this information. Something that's embedded into the step up to quality practices is that families share information on health and safety, health and child development. So when we think about that, our state has already decided that this is something that's very important and we need to be paying attention to.
Right, absolutely, thank you. Another thing to share with you, and Delorise and Leslie alluded to it, is although these briefings are really designed for community partners, donors, interested folks in the community, parents, we also provide a huge stream of support and information to childcare providers. In fact, during the first couple of months actually of the pandemic, every single day, we were communicating to childcare providers, making sure they knew, here's new guidelines, here's what we know, here's opportunities perhaps for you to get some help. Here's trainings that are key. We created this amazing group coaching cohort where we weren't sure, you know, we're kind of, well, we'll build it, we'll see who comes. Well, it turns out everybody came, which is beautiful. We had 50, 60, even 70 childcare providers coming in. We had coaches, folks that were on Deloris's team, Leslie's team, our Miami Valley teams, and really helping childcare providers problem solve, because that is another part of this. It's one of the interesting things about childcare. Just because a guideline says providers must do A, B, C, the actual execution of that is different in every setting, because every setting, whether it's 10 different homes for family childcare or 10 different centers, each setting is different. So the coaching in particular that their teams provide has been vital. And we created remote coaching capability since, you know, it wasn't safe to be in person, which is the way we would normally coach on site. And that's been vital. What I will say though, is we do have providers and families that are reaching out to us every day. That is what we're here for, as well as our community. We want to be a resource. So that leads me to another question that we've got here. And this could be, you know, a provider certainly has this question. I know parents have had this question. And the question is a big one right now. So if my child is in a program right now that does not have school agers in it, and now school year is going to start, and that might mean that a school-age child is going to join that program, whether that's the before and after school component, or whether there's space for that school-ager to be there all day on the days when they're not in the school setting. So is that safe? You know, the short answer I would tell you is that we continue to say you have to follow what your family's comfort level is. And as a provider also needs to take a look at the situation and assess each situation. So Deloris and Leslie, I don't know, I know you have gotten questions like this, whether you were responding to a parent or to a provider. What might you say to help people with this question that's very much on their mind right now?
So one of the things that I will address as well is making sure that families are also following what the state has in place, because one of the concerns has been that my families aren't wearing masks or following the procedures. So educating the families on what the requirements are, you setting policies and procedures within your own program to ensure that you are doing what is safe, and making sure that parents are aware and educated on it. And ultimately, I wish I could say that we could control even what our young children do when they leave us. We really can't. And so when we think about school agers being added into the program, if you have a younger child and they're a sibling to a school ager, like in my home, that's an exposure. But we do want to trust and believe that our school districts are putting things in place. Daily on the news, they're talking about each school district and the safety precautions that are being taken to ensure that children are safe. So definitely updating your policy and procedure to match your comfort level, and supporting the children and families with following through with that.
What would you add, Leslie?
So Deloris is right on track with exactly what I was about to say, that it is the program's responsibility. I would strongly suggest that they put their new policies and procedures into place that allows families to have that comfort level and to communicate that clearly. These are our new requirements, and having parents understand that when you bring your school ager to the program, or when they're transported to the program, that these are our new policies and procedures in place for safety. And for parents to understand and know that our programs are doing their very best to provide a safe and still quality environment for their students and for their children. They have so many new cleaning regimens in place, and so many new not just the actual regimen, but the time frames that are happening on a consistent basis to ensure that the environment stays sanitary. So if you are a parent, visit your program, have a conversation with that administrator and ask, what are these new policies and procedures you put in place for the safety of these school-age children, in addition to when they come into the center with the other children?
Absolutely. And, you know, parent engagement is one of the key components, actually, of a quality childcare setting.
Yes.
This is a great time to really focus on that. Whether you're a provider, you know, this is a great chance for you to have those conversations. But if you're a parent, you know, if you haven't heard from the provider, as Leslie and Delorise have said, talk to the provider. So parent engagement is a key quality component. Again, I would just remind folks that, especially in childcare, there's actually a lot more training on health and safety than there are in, you know, I would say a standard school-based setting, because you're dealing with young children. It's part of what goes with the industry. So that's good news. I wish we could give you just a very clear yes, no answer, but it really won't be. It just won't be a clear yes, no answer. And I will also say, you know, in the end, we're going to have to make some judgment calls, whether that's about our own families, those judgment calls, or childcare providers may be making some judgment calls about what they think will best keep the children in their care safe, because that's what they are focused on. No question about that. We also got a question about women and, you know, women and the workforce. And the reality is, some of you may know that before I came to 4C, I spent many years running the Women's Fund of the Greater Cincinnati Foundation, was proud to do that. And a lot of our work actually was focused on the economic self-sufficiency of women. So there is no question that this crisis is impacting women more proportionally, larger proportion of women. We have a lot of women who may be head of household, and many of those in turn are getting help to pay for childcare. So this whole scenario is one that is really impacting women in our community. And the other part of it is, when you look at the statistics of what jobs women are prevalent in, they tend to be very heavily in those jobs that have what we call non-standard work hours. So retail, restaurants, things like this. So not only do they get this massive hit economically, because many of those jobs have still not come back, but there's also the question about what kind of safety net would they have given their earnings capacity before the pandemic hit. So again, women are a critical component of our economic infrastructure, and I appreciate the question that came because yes, there is a disproportionate effect of this childcare challenge within our community. This is a moment of equity. Equity, certainly gender equity is a component of this, and racial equity is a big part of this. We cannot come out of this pandemic and see that more childcare programs closed in the areas where we have economic strain, and just have the programs survive, or more programs survive, that are perhaps in our more affluent neighborhoods. That would be devastating on many, many levels. So whatever it is from your seat that you are passionate about in the community, I would say that you're likely to find a connection to that issue with this childcare, this pivotal moment in childcare. So again, I would remind you, you're going to get a follow-up message from us, not only for you, but please share it among your network. Whether it is advocacy, or you're able to financially support the future of childcare in our community, or both, this is it. This is the moment. And I hope we can all look back and say, I know we were part of making sure our communities got through this pandemic And I can look out and see all these child care programs, all those children, all those families, all those businesses, they're still there because we were part of making sure they survived. So with that, I am going to say thank you so much to Delorise. Thank you so much to Leslie. They are just amazing leaders in our agency. They bring positivity to what they do every day. And I can tell you, it's been a difficult number of months. The work that we do is at the epicenter of all of this. We are proud, though, to be part of that and to be part of those solutions. Thank you to all of you. I know you took an hour out of your day, which I'm sure is quite busy, to be here. And thank you for caring about this. And thank you for continuing to seek out ways that you can make a difference. So have a great day. And please, if you have any follow-up questions, just send them our way.